Good day. I'll be taking you guys through the pharmacy module on the APMIS HMS solution. The first thing you need to do, you need to log in your credentials. As you can see, I'm already logged in. Once you log in, you navigate to the pharmacy module. I'm on the pharmacy module currently. So when you are in the pharmacy module, there are different tabs you notice. You see the prescription, you see the external prescription, the walk-in, the go to store, and the check-into store. The prescription basically is for patients that are in the hospital that the doctor referred to the pharmacy, prescribed drugs for them to the pharmacy. Like if you look at the prescription currently, I have a patient, John Kumi, from Priority Normal. The prescriber is George Silva, which is the doctor in the facility. So presently, the doctor prescribed a drug to the pharmacy for John Kumi. So when you click on the name of the patient, it automatically shows you the name of the drug that was prescribed by the doctor to the pharmacy for that patient. If you look at, we have diclofenac sodium 50 mg, oral tablets, and the instruction on how the patient is going to use the drug, you use with warm water. So the first thing we need to do in this instance, for we to be able to dispense the drug to the patient, we need to bill the product. So when I click on bill, it will automatically take me to it will generate a bill invoice for me. You see, generate bill for diclofenac. So I choose the quantity I pick the drug I want to give the patient, dispense to the patient. Then I also pick the quantity I want to dispense to the patient. I can say 2, and that automatically accumulates the price of the drug, total price, which is 1,000 naira. I save. So once I saved, it shows me now that that drug has been billed to this customer. Quantity is 2, unit price is 500, cost of this drug is 1,000 naira. So once I do that, I can go ahead and save the prescription. So once I save the prescription, it drops down to prescribed items for dispense. Then it shows me not dispensed, and if I've not also made payment for this drug, it will show me not paid. So you can go ahead and fund the wallet of the patient and pay for the drug before you go ahead to dispense the drug. Okay, we quickly went to make payment for the drug that was dispensed, that was prescribed to the patient, that was billed. So as you can see, we've made payment for the drugs, and you see, but the status is saying not dispensed. So we'll now go ahead and click on dispense. To dispense, product has been dispensed successfully. So when I come and refresh, so definitely, when you refresh the page, it will show that the drug have been dispensed. Okay, people will now talk about external prescription. When I click on external prescription, basically external prescription are patients that are being referred from that walks into the pharmacy out from the outside. They walk into pharmacy, external doctor external doctor referred them to the pharmacy. So these are the external prescription takes care of that. When the doctor is being referred a patient, you see the list of the patient that the doctor referred, and you can also attend to the patient prescription from external prescription. Then we'll talk about walk-in. Walk-in simply means a random individual walking into the pharmacy to buy drugs, to get drugs. So in order for you to be able to do that, all you need to do is to come on clients, pick the type of person walking in. If it's an individual, say individual, then you get down the phone number of the walking person coming into the pharmacy. Then you get the first name of the person, the last name and the first name, very important. Then you click on the product that you are, the drugs that you are trying to dispense for the walk-in patient into the pharmacy. So I pick the product, it automatically generates the batch number for me. I choose which of the batch I want to dispense for the patient. I pick on this batch, I choose the quantity and to dispense for the person, let's say three. Once I click on that, I click save. This will automatically bring that prescription down to where I can go ahead and click dispense for the patient, the walk-in patient into the pharmacy. When I click dispense, you can see to dispense the drug to the patient. So when you click on go to store, it just simply takes you to the store module. It takes you to the store module, and basically click on check into store. It's basically changing from one store to another store under your facility. So I'm currently logged on to the central store. So that is that basically for the pharmacy module. Thank you for listening.